Castor oil, the little brown bottle your grandparents swore by, used in ancient Egypt, prescribed in 19th century pharmacies, and now revived by natural health educators like Dr. Barbara O'Neill. It's claimed to help with pain, digestion, detox, skin, and even pet care. But what's real, what's risky, and how can you use it safely today? In this video, you'll learn the fascinating history of castor oil from the 1800s to now, evidence-based benefits and side effects in humans, why the castor plant is dangerous for animals and what cautious vets say about using the oil on dogs, and how to use castor oil externally, step by step. This is educational only, not medical or veterinary advice. Always talk to your own healthcare provider or vet before trying any remedy, especially on children, pregnant women, or pets. Castor oil comes from the seeds of the castor plant, Ricinus communis. The raw seeds are highly toxic because they contain ricin, a potent poison, but properly processed castor oil has the ricin removed and is considered much safer when used correctly. The main active compound in castor oil is ricinoleic acid. Inside the intestines, enzymes break the oil down and release ricinoleic acid, which stimulates receptors in the gut wall and causes strong contractions. This is why it works as a powerful laxative. The same pathway can also stimulate the uterus, which is why castor oil has been used to induce labor, but also why medical sources warn against using it in pregnancy without strict supervision. Castor oil has been used for thousands of years, including in ancient Egypt for lighting lamps and medicinal purposes. In the 1800s and early 1900s, it was a staple in European and American households. A spoonful was given to children as a weekly purge for constipation, intestinal worms, and cleansing the system. Pharmacies sold castor oil alongside other plant-based remedies like senna and cascara. In the early 20th century, figures like Edgar Cayce popularized castor oil packs, cloth soaked in castor oil and applied to the body, for everything from joint pain to liver congestion. Naturopaths and later educators such as Dr. Barbara O'Neill have continued this tradition, reporting improvements in pain, cysts, and digestive complaints, with regular use of castor oil packs. As the pharmaceutical industry grew through the 1900s, focus shifted to patented synthetic drugs. Castor oil and many other non-patentable natural remedies largely disappeared from mainstream treatment guidelines, even though they remained in some pharmacology texts as strong laxatives or topical agents. Critics argue this sidelining was economic rather than purely scientific. Regardless, today castor oil sits in a grey zone, still recognized in medical references, but no longer a frontline treatment. Let's separate two very different uses, internal and external. Internal use, drinking castor oil. Modern medical references still list castor oil as an approved stimulant laxative for short-term relief of constipation or as part of bowel preparation, but it's used much less now because it causes side effects so often. Studies and clinical reports show that typical doses can cause abdominal cramping, diarrhea, nausea, and sometimes dehydration or electrolyte imbalance, especially if people take too much or use it repeatedly. Because ricinoleic acid stimulates uterine contractions, internal castor oil is generally not recommended in pregnancy outside a hospital setting and is contraindicated in suspected bowel obstruction, inflammatory bowel disease, severe dehydration, or serious illness. Many doctors today prefer gentler laxatives like polyethylene glycol or lactulose over castor oil. External use on the skin. Externally, castor oil is much better tolerated. It is widely used in cosmetics as a thick, moisturizing oil and is not considered systemically toxic when applied to intact skin. Laboratory and animal studies show ricinoleic acid has anti-inflammatory and analgesic, pain-relieving effects. For example, it reduces swelling and pain in standard inflammation models, suggesting a plausible mechanism for joint and muscle relief. Small clinical studies and case series suggest benefits in knee osteoarthritis, where castor oil-based regimens improved pain and function with fewer gastric side effects compared with oral NSAIDs. Wound care and skin conditions, where castor oil dressings support moist wound healing and have mild antimicrobial and soothing effects. The main risk from topical use is contact dermatitis, redness, itching, or rash in sensitive people. So patch testing on a small area is advised before regular use. 5. How to do a classic castor oil pack, 4:30 to 6. Here is a commonly taught method, similar to what Dr. Barbara O'Neill and many naturopaths demonstrate. This is for external use only and should not be done in pregnancy, over open wounds, or without checking with your healthcare provider if you have serious health conditions. You will need cold-pressed, hexane-free castor oil in a glass bottle, a piece of natural flannel or cotton, folded several layers thick, plastic wrap or a dedicated reusable cover, a hot water bottle or low-setting heating pad, an old towel. Prepare the cloth. Pour castor oil onto the folded flannel until it is saturated but not dripping. Position the pack, lie down and place the oiled cloth over the target area. Common sites are over the liver, right upper abdomen, across the lower belly for menstrual discomfort, or over a painful joint. Cover and heat. Place plastic wrap or a cover over the cloth, then put the hot water bottle or heating pad on top. Add a towel under you to protect bedding and clothes. Relax. Rest for 30 to 60 minutes. Many practitioners suggest doing this 3 to 4 times per week, or in cycles of several weeks on and off. Clean up and store. Remove the pack, wipe the skin with a mild soap or baking soda in water solution, and store the oiled cloth in a closed glass container in the fridge. Re-oil as needed. Stop immediately if you notice skin irritation, feel unwell, or experience any unusual symptoms, and speak with a healthcare provider. Now let's talk about animals, especially dogs, because this is where misinformation can become dangerous. The plant versus the oil. Veterinary toxicology sources are very clear. The castor plant and its seeds are highly poisonous to dogs, cats, livestock, and humans because of ricin. Even a few chewed seeds can cause severe vomiting, bloody diarrhea, weakness, and organ damage, requiring emergency treatment. Properly processed castor oil contains little to no ricin, so the oil is much less acutely toxic. But it still has strong gastrointestinal effects and can be hazardous if a pet ingests too much. Internal use in dogs. Veterinary manuals list castor oil as a possible laxative for dogs at doses like 5 to 25 milliliters by mouth. But they also stress this should only be done under direct veterinary supervision after ruling out blockage or serious disease. Side effects in dogs mirror humans: abdominal cramps, rapid diarrhea, vomiting, dehydration and electrolyte problems, and it may trigger abortion in pregnant animals. Some holistic vets talk about half teaspoon per 20 pounds of body weight, up to twice daily for a couple of days. But even they warn that larger amounts can quickly become harmful. The safest approach is simple. Do not give castor oil internally to your dog unless your veterinarian has explicitly prescribed it and explained the dose and monitoring. Topical use in dogs. For external use, some pet care sources and holistic vets cautiously use small amounts of castor oil on cracked paw pads, localized dry, non-infected skin patches, mild joint soreness. Even here, the guidelines are: dilute it with another oil like coconut. Apply only to a small test area first. Prevent licking, use a cone or supervise. Avoid eyes, open wounds, and sensitive areas. Stop if there is redness, itching, vomiting, or diarrhea. Mainstream veterinary advice often prefers better studied options for skin and joint issues and reminds owners that what is natural is not automatically safe for pets. To wrap this up, for humans, there is scientific and clinical support for castor oil as a potent laxative and as a useful topical agent with anti-inflammatory and wound-healing properties. But internal use is harsh and should be short-term and medically supervised. For pets, the castor plant is clearly toxic, and the oil, while less toxic, can still cause serious GI upset. Internal use in dogs belongs strictly in the hands of a vet, and external use should be cautious, small area only, and ideally vet-approved. If you found this deep dive helpful, let me know in the comments. Have you or your family used castor oil packs? Did your vet ever recommend or warn against castor oil for your pets? Don't forget to like, subscribe and share this video with anyone curious about powerful traditional remedies and how to use them safely in a modern world.